Hey, it's Dr. Steve. We're going to talk again about doing some taping on the big toe, particularly if we're someone that's starting to develop a bunion or who has difficulty with pain in the toe upon moving. A lot of times what we actually find, if you take a look at this person's feet here, we've got a pretty good orientation in the knuckle through here. You can see a swelling and enlargement of the knuckle on this side. What that typically will do is it'll cause your foot to lean in this way while you're walking, and as a byproduct, increase pain into the toe itself as well as up into the shin bone through here. So we're going to talk about a little taping methodology we can use to actually start to pull this back a little bit, take some of that strain off, help with the gait. In addition, we're going to recommend we actually put what's called a toe wedge right between here, or a toe spacer, so it actually helps move this through. So one of the things we want to do when determining whether or not to tape the big toe, whether we want deviation or a lift strictly, is we want to actually look for a hip flexion. As the foot moves over this direction, the toe deviates. As we step, instead of a nice good move this direction with the foot comes, it actually rotates and torques. That causes a spiral spin up the leg itself, which causes a weakness in the hip flexor. So you can see with this patient on this toe here, we start some of the bunion, but not so much here as it's beginning to develop. If I raise this up like here and I push down, the patient doesn't have strength. So resist as hard as you can. There's absolutely no strength in through there, and that indicates that we have a weakness. Now if I have her just lift the toe up like this, hold that up for me, hold tight, and I push down, it helps, it's good and strong. So if I had a little cotton ball in through here just like that, raise that tape up for me, hold tight, we can actually see that she gets good strength when we actually pull the toe out. Bring the toe up for me. She has some, but not quite as much. So her biggest issue is we want to pull it out. I'm going to go ahead and show both tapings for you. Actually one with up this direction and out, and the other one just straight out through here. So this is a functional movement test, and we're actually evaluating the hip and leg strength as a byproduct of potential problems and pathology at the foot. So I'm going to go over a little taping method we've been using over the years. One of the things that we find really beneficial is to actually do two different methods depending on what you're trying to accomplish. So if the patient's having difficulty with actually walking because of pain in the knuckle, we want to use one technique first. You're going to use a full strip about like this for the side of the foot. What you're actually going to do is you're going to tape it to the top of the toe like this as she raises it. Go ahead and raise that toe for me. We're going to come down on the side as well. And then the tape is going to come about 20% pull down along the side and through here. And this will do two things. Number one, it'll help pull the toe over, as you can see now, I'm pulling, and up. This is not one that I generally do, as I find it isn't the main problem most people have. So we're going to go over the second taping, which I like a little bit better. I think it fits better, works better. And that's actually where we take the tape. The shape we're going to do a cutout here, so it actually fits the toe a little bit better. Look like this. You're going to take this piece, you're going to anchor it onto here, and then you're going to pull the toe slightly out and lay it down. This allows for a little bit more effective support. So it's a little long, you really don't want it going all the way up to the ankle. So about here. Now, in order to keep this in position and allow it to work for us, there's two other ones that we're going to recommend. One is a medial arch support, and the second one is actually when I type down the toe itself. So on the big toe, this is just really to hold it so it doesn't pull off when they're walking. And then the forefoot, again keeping it from pulling up. About a 30% pull, just like that. That'll actually support the toe coming out, help them work a little bit better, give you better support within. All right, so now we're going to recheck the foot and the leg. We're going to make sure that the hip flexor is nice and strong, so hold tight here for me. Now when we push down, we've got a good strength on there. That means it's actually worked.